This evening, and it is evening here, I don't know what it is, what the folks who are viewing this are going to be, but I had the great pleasure of getting Dr. Westman and Jacqueline Eberstein. It's Eberstein, right?
Yep, that's correct.
I never can remember whether it's Steen or Stein.
No, it's Steve.
Yeah. But this is like 2 years in the making, because when I was here last time, I got to talk to Jackie, but I didn't get to talk to you. And with your rather full schedule, I'd probably never get another chance. So I'm really glad to have you tonight. For those who are watching this, be aware that this is happening on the low carb cruise, which is one of the reasons you may see a little bit of shake in the video. It's not as bad as I was afraid it was going to be, but if it bothers you, close your eyes and just listen. It's very important information. Now, basically, I invited Dr. Westman and Jackie here to talk about a new venture that they started about 2.5 years ago, right?
Yes. Called
the HEALClinics. And so I wanted primarily to give you an opportunity to talk about that, especially, well, I've heard a little bit about it, but I'm also a little curious as exactly how you're going about this and what it is you're planning to accomplish. And this is your brainchild, right?
Right. Well, it's the brainchild of anyone who thought about ever using a low-carb diet. But it's how to get more and more people on board or get trained into doing low-carb diets. And so I'm an owner of the company, but really we're just trying to make a mechanism for other people getting to learn about low-carb, high-fat diets, not only to treat medical problems, but to just teach people how to change their life in terms of energy level, in terms of obesity. So HEALClinics, HEAL stands for Healthier Eating and Living, is a mechanism, a company to train practitioners in how to help other people do low-carb diets, and so people can actually learn how to do it today. And I just have to say, we borrow on Jackie's experience with the HEAL method of nutrition, which really came from the Atkins Center. That's the place where Jackie worked for so long. So it's an honor to be able to carry forward and hopefully to expand in a huge way the nutritional treatments that Dr. Atkins and Jackie established many years ago.
Which reminds me, I'm kind of remiss in introducing you folks. Dr. Westman here is the immediate past president of the American Society for Bariatric Medicine, or
the Obesity Medicine
Obesity
Association.
Medicine.
We changed the name, so it's confusing.
Yeah, it's just changing it.
Yeah. And Jackie is the longtime nurse for Dr. Atkins. It was like 28 years.
29, almost 30. Yeah.
And we are being joined by Hurricane Melanie. Have a seat. Okay, we can do some editing if we need to.
Sorry.
Some of that. So now, Melanie Miller is a recent new hire to the organization, right? When did you start with them?
About a year.
Yeah.
Okay, so that's relatively recent, but you've been here for a year. So what is your position?
I was just going to say, one of the great things about now talking about a company to do this in a big way is you meet people who've done it for 30 years or have the knowledge. Then we meet people who have the enthusiasm to approach and to teach other people. And so Melanie bubbled up, if you will, as someone who taught a lot of people on her own. And we asked her to be a part of the HEALClinics because of her own personal experience and her experience leading other people in West Virginia.
And I had the opportunity to see your presentation. And yeah, you're definitely earned your nickname?
Vivacious
No,
or
no, no.
hurricane?
Hurricane Miller. Hurricane Melanie.
Thank
So
you.
you're the marketing director, right?
No, I'm actually the director of engagement.
What's the difference?
So a marketing director is the one that helps us with our materials and positioning for Heal in the market. And I'm actually the one that's engaging people who need help, people who are looking for an opportunity to finally get healthy. So I'm out in front. I go out and I speak and I teach and train on behalf of these guys right here.
Mm-hmm. Now you mentioned that it's more than just obesity, but when I think of low carb diet, I think weight loss. Would that be the majority of your clientele?
Well, currently, because people think of the low carb diet as being a weight loss diet, but it's much more than that. And so I've never really had to lose much weight, but I choose to eat in a low carb diet way because I feel better. There's less inflammation, less hunger. It's just a healthy way of eating. Although I think most people do think of it because Dr. Atkins and Jackie used it in a setting for obesity, and that was what the need was. People think of the low carb diet as an obesity treatment diet, but it is more than that.
Well, there's so many other illnesses associated with obesity. And that's really the point, is not just to help people lose weight so they look better, but to help people. First of all, we can't prevent chronic disease. And type 2 diabetes is certainly preventable. Most people don't know that until their doctor tells them they have type 2 diabetes, and then they wind up on 2 or 3 or 4 or 5 drugs that they're expected to take for the rest of their lives. And as they get older, they often wind up with more medication and even in insulin injections. And so what we know that doesn't have to happen if you adequately and properly control carbohydrates, because diabetes is a disease of carbohydrate intolerance. And so what we want to do is help people lose weight, because if you lose weight, you're going to decrease your chances of those kind of conditions related to obesity. But the other point is that if you already have them, then we can help you get off medications to get healthier and lose the weight, because losing weight is a part of the treatment for people with diabetes. So it's part of prevention, and it's also part of a safer treatment, and a treatment that's going to make you healthier in the long run. And then there's all the other associated things that get better when you do low carbs. Your headaches go away, your energy's better, your moods get better, your joints get better, reflux gets better. I mean, it does, what you eat makes a very big difference in how you feel.
About 6 months after we started low carb, I came across this industrial size jar of Tums that we used to basically double several a day. And I'm like, wow, we don't need these anymore. Toss them in the trash.
Well, and patients wind up on medications like for reflux. They're on all these medications you see advertised on TV and in magazines. And the small print says they should only be taken for short term. Yet we've interviewed people at the Atkins Center who are on them 4, 5, 6 years. They can cause osteoporosis, they can cause B12 deficiency. But once you're placed on these drugs, it's thought that you're just going to need to remain on them. And that's one thing that clears up very quickly when you control carbs. Your GI symptoms get better.
I've also noticed from just anecdotally that once a doctor actually diagnoses you as a type 2, that you've been in trouble for some time.
Yes, I mean, some of the research shows with prediabetes, which is a condition that happens before you actually get numbers high enough to be classified as diabetes. These are numbers that are somewhere between diabetes and normal, that you're already losing the insulin producing cells in your pancreas. And once they're gone, they're not coming back. And you're also damaging your small blood vessels, which leads to the complications of diabetes. So it's not like you're perfectly normal and then healthy and then you have type 2. It's not that at all. So one of the things we do at HEAL is we can evaluate your risk for diabetes based on a variety of blood tests and other signs and symptoms you have. And then we can tell you what to do about it so it doesn't advance further and actually put you into a remission. And your blood tests can look like perfectly normal as someone who never had that condition. And that's really what we like to do before people wind up with a diagnosis of type 2.
Now, I had a conversation with you the other day about blood testing and the various ranges. And And you had some very interesting things to say about, you know, what are these ranges all about, and what, you know, what are they based on, and what do they really mean? And so you have a range of cholesterol from such and such and such and such, or a range of CRP. Where do those come from?
Well, one of the things I think that happens is when the doctors look at a group of blood tests that they've ordered, they don't necessarily look at the numbers, but they look to see what's marked high and what's marked low. And if you're normal, then they don't pay much attention to that. But the way those numbers are determined is they take a large group of people who don't have acute disease. They don't have cancer, they don't have heart disease, they haven't had a stroke, they don't have high blood pressure, and they'll average out what their levels are in the blood. Now, they may not be perfectly healthy. They might have hemorrhoids and indigestion and get migraine headaches and have their joints hurt. So they're not completely healthy. And then they take an average, and this is what the normal should be of this average of supposedly healthy people. But that doesn't necessarily mean that's an optimal level for you. And that's one of the things that we want to look at HEAL is really there's no one size fits all. You look at lab work and you have to look at the patient's symptoms. And so it isn't just, yeah, you're normal because your cholesterol falls below 200. But if it's 202, we need to write you a statin because that's not a good thing. We don't do that at HEAL. We really look at our patients individually and look at their symptoms.
So how are you going to go about narrowing these ranges for the individual to tell them what they ought to be as a target? How do you do that?
Well, first you measure a baseline, and then with the changing diet or lifestyle change that we introduce, you measure it again. And then actually with some of the measurements, the lower the better, even if it's below what other people see. Like inflammation, we want it to be as low as possible. Something like blood sugar, you don't want it to be too low, blood glucose, but you want it to be in the, what would be low normal for people who don't eat in a low carb way. So
I had a friend who was type 2, and he said, oh, this morning my reading was 55, and I said, you need a new meter.
Yeah, wow.
And he says, why? Because you were conscious.
So that's an interesting thing. Actually, if you're running on ketones, you're a low carb person,
Get that low?
ketogenic diet, you can get that low and feel fine because you don't need the glucose as much. And so in a couple studies that we've done, we've actually asked people to be in ketosis, make them do some change. Like in one case, it was eating a carb meal. In another case, it was having some alcohol to see the effects of that. And if you're having lots of ketones in your blood, they're a little higher, and they might actually have a blood glucose that's below what's thought of as a normal range, a normal glucose, and they feel fine. So actually, I've seen people with a 53.
Well, I do
feel
know
fine.
that my friend was not on a low carb diet.
Well, then that probably wasn't good.
No.
But it's interesting because we're kind of creating a new normal range of people who don't eat carbohydrates.
And you calculate those ranges for people who aren't on statins and things like that. How about blood pressure medications and things like that? Do you have a protocol that you use for blood pressure?
Absolutely. So anyone on a medication with medical problems need to be monitored. And you can monitor your own blood pressure, blood sugar. If you're not comfortable with that, absolutely do it with someone, a doctor who's trained to do that. And at HEAL, we train practitioners to help adjust the medicine down, basically tapering people off medication. When the blood pressure or blood glucose, blood sugar gets to the low normal range, we start tapering back the medication. And that's exciting because there aren't many other doctors that take away medications, and yet we can do that safely with monitoring.
So actually practicing healthcare.
Yeah, it's really
Healthcare,
about
not
health,
sick.
not about sickness.
That's right.
That's exactly right. Yeah.
And now, so we kind of geeked out here with the mechanism. So we're going to talk to the engagement expert. What are you going to do for these folks?
What am I going to do for the people that we care for, or for
For HEAL, for HEALclinic?
What am I going to do? Well, what have I done is probably a great question.
Okay.
So I met Dr. Westman when I was on my weight loss journey. I've lost almost 100 pounds myself. I had actually lost probably 30 pounds when I first met you. And I just had a goal to reach people, try to help them get healthy. And as a nurse, nobody ever told me about this way of eating. You know, I had heard of Dr. Atkins and, you know, some of the protocols, but I was taught the bacon was horrible. So when I found out that it was legit, that I could eat it and lots of it and get healthy, then I figured it's time to share this. So I had told him that I was going to start a community support group, and it's called the Low Carb Revolution. And our first meeting, we had 70 people show up. So it was pretty powerful. And then a month later, we decided to do it again, and there was 125. The month after that, there was 175.
You must have been impressed by all that.
Indeed, I was impressed. I am impressed.
You are?
Yeah.
And then in 2 months after that, we had another meeting, and actually there was no room on the floor, like for people to sit. There was 225 people in that small room. And so then, by then, I thought I had gotten his attention, like, you know, I think I'm onto something here. I really need your support. So he didn't hesitate to come out to the second most obese state, which is West Virginia in the United States. And we were second because our BMIs are over 35. So it's horrible. So you are getting diabetics every day. It's just absolutely nuts. So we had him come in, and he spoke, and he walked into the room. There was over 400 people there. These are people that he sees in the clinic every day. This was not the scientists, the experts, or anything. He was the only expert. And so these people had come from everywhere just to hear him speak, because they have a dream of becoming healthy without taking a bunch of medication.
How did you advertise this stuff? How did you manage to get 400 people all in one place?
Well, I have a marketing company. I've been doing marketing for about 15 years.
Mm-hmm.
I work with guys that played in the NFL for the Redskins. And so I just decided that maybe this recipe that I had created for my businesses that I was helping to promote, I could just try it on myself, being, under the scope of low carb. And so it worked. And so then after he came, he basically was like, oh my goodness, I've only seen this one time, and that was in South Africa, Melanie. This is amazing. And so then that's when you invited me a week later. You had me get on the business call with the team at HEAL, and we began talking about what it would look like if they had somebody that was a little different, like me, to come on the team and help grow HEAL.
Mm-hmm. Now, HEAL started out with some kind of a Kickstarter program. How did you raise your seed money?
No. So it started with investors on the low carb cruise. So in fact, our initial investors were the ones who urged me and other low carb people to do something. Why don't you do something? So I came back to a cruise and said, okay, I have the team set up, invest in us. And so no, most of our investors, we have 80 investors now at relatively low, it's individuals who have been affected by the low carb diet, wanting to figure out a way to get back or to expand the availability of it.
So are you still attracting new investors?
Absolutely.
What kind of minimum investment would you expect a new investor to make?
Well, so that's going to be dependent on what someone has to offer and to put in. My business partner, Bruce Rossiter, is the one who would help establish that. And I think in terms of other investments, it's relatively low. I think people come in at $25,000, somewhere in that on average. And we're working now with an investment bank to expand the opportunities for people to invest.
Now you gave a presentation here on the cruise about commercialization of low carb. And the motivation here is, well, it's not sustainable unless we can get money out of it. And so you're it's kind of a double-edged sword. People say, oh, he's just in it for the money or something like that. But you made the case for we need to actually make money or we can't do it. So how are you going to make money off of this?
Right. Well, so that's the puzzle. That's the conundrum. If how do you expand the availability of it when our current medical system doesn't offer it? And that's by creating a mechanism of getting a company going where you, for a very a modest or reasonable fee, you offer the services and then give it to more and more people. So the company itself is a relatively inexpensive sort of thing. You go to the website, HEALClinics.com, you're either put into a medical or a non-medical arm. And the way we make it a business is that we train people to teach people how to do it, and they get paid part of the payment that people apply for in a subscription way to get the support to make the lifestyle change.
So you're holding seminars, or are you just treating?
Well, on the individual level, it's a one-on-one with a partner.
Mm-hmm.
So if someone needs help doing this, they want to do it right the first time, ask someone who's already been there. So Heal Clinics will put you together with someone who's already done it. So someone like Melanie, who's lost 100 pounds, gives that coaching and the individual personal attention that so many people need.
Speaking of that, we got Melanie who's lost 100 pounds. I've lost about 125, and yet I'm still overweight. And I've been kind of treading that same place, treading water for years.
Sign them up.
Yeah.
So you've got something to offer me as well then.
Absolutely.
Yeah.
So what would be the issues 100 pounds into it?
Yeah. So if you were, let's say you were, well, as he was just explaining, there's two sides to the company. So we have the medical side, the non-medical side. So we have some people who are trying to halt their diseases, their diabetes, prediabetes, something like that of that nature. So what happens is they go online, they simply fill out, they click on the right-hand side, it says click to enroll. So they go and fill out this application, which basically gives us an outline of what their health status looks like. Now, wait, this is the coolest part, because that information gets emailed to a legend. This lady right here, Dr. Atkins' nurse, and she's on our team. So she's the one that evaluates it. And it's up to Jackie at that point whether that person becomes medical and have to be seen in the clinic, or if they're non-medical. And the non-medical piece is appropriate for someone who is trying to lose some weight, but doesn't have the diabetes or the prediabetes. It could be somebody that's just tried everything and they can't make it. They're just like you. They're like, oh, I'm trying to get through. I'm stuck. And so they come to us to get unstuck. And of course, we have the global experts. So by coming to us, we have people, like Dr. Westman said, like myself, that have been through it. They understand it. They get it. They know how hard it is. They know, what you had to do with your mindset to finally get to the place to even fill out that application. And so we have not only that, so you got an incredible situation where you also have commitment coaching. And our commitment coaching is something that Dr. Westman always wanted to put at Duke, but wasn't capable because of legal, I don't know, stuff. But so he brought this other part to the company. So explain to him what commitment, because you're so much better at that with the commitment coaching.
Yeah, well, in a clinical setting, one of the things that was missing that is so helpful for people is the idea of how to set goals, how to accomplish them. And everyone talking about food is one thing, but the food is relatively a minor part of it.
That was one of the things I had against Weight Watchers. You get a bunch of these overweight people get together to obsess about food for an hour.
So commitment coaching allows you to focus on the bigger things. Like really, what are you trying to accomplish? Is it to be around for your grandkids? Is it to be able to walk up the stairs?
You're throwing in some psychology.
This is absolutely psychology. Yeah.
Now, I'm sure we could go on for hours talking about this. I'm kind of excited about it myself, but I promised that I wasn't going to keep you guys real late. I do want to wind up with your URL. It's HEALClinic.com.
Clinics.com.
HEALClinics.com, and you can go to that website and you can sign up and you can go through the introductions there, any thoughts or forms.
Can I tell you the most important part about that website between the people signing up
Yeah.
is you can go and read real life stories of what is happening right now with people that have been touched by the HEAL program and by our, our HEAL Care for Life program. These are people that they have changed their life. Their stories are amazing. They inspire people. We have collectively, I think we can agree on one. We have a guy who he's only 20 years old and he's lost 135. And he came last year to the first event before I even started to HEAL, and he said, "That's it. I'm going to change my life. I'm gonna be healthy." He didn't even think his life was worth living anymore. He was depressed and everything. And so these guys came in a month ago and did an amazing forum where they teach on the low, because when you're starting, there's, I call them low carb babies. They don't understand yet. They don't even know what a carb is. So then this superstar, she's amazing. She taught about carbohydrates and what they do to your body, how they function. And then of course he brings the thunder with understanding the whole way that we eat, why we eat that way, and how it's going to affect your body, because he's the doc. So it's just absolutely powerful. But this guy stood up at this last event a month ago and he said, "I waited until this, I've been waiting for this very moment to stand up here and share my story." And he goes, "I have everything to live forward to now." And he brought his clothes. He's so proud. And now this young man is 21 years old and he's aspiring and inspiring people all over the world. He's just an amazing
How
story.
much weight did he lose over the year?
135.
So are you guys going to eventually be so successful you're out of business?
No worry about that for a long time, I'm afraid.
Okay, well, it has been great talking with you. I've had a good time on the low carb cruise, and I enjoyed the presentations. And I was really impressed by that energy level that you had.
Well, you're going to come tomorrow, right? After lunch.
You going to do it again?
You're going to see it on a different level.
Oh.
Because there's so much comfort between. We are a family at HEAL, and these two are mentors to me. They've helped me become who I am in this world, in regard to the low carb world. And we're just changing lives so much. So tomorrow we get to bring it a whole nother level with both of them there. And you'll get to see inspiration.
Like I said, I tried to get Dr. Westman 2 years ago, and we just couldn't get our schedules together. So this was 2 years in the making.